Rahim. We've been doing lots of videos on hair transplant surgery, post-operative care, intraoperative care, and before surgery prerequisites. Hair transplant surgery is a very, very serious process because in this procedure you are doing something better for your cosmesis. And what we need to do is we need to take care of everything like naturalness, like density of the hair, like to avoid poor growth. And we need to discuss more important. We need to discuss each and everything to the patient, and patient should be aware of what you are doing, what are the outcomes of this procedure, and what is the permanent outcome of this procedure, because most of the hair taken in hair transplant surgery are from most permanent hair on back of the head, and these hair are transplanted in the recipient area to remain there forever. But thing is, a patient should be explained that donor area keeps thinning as well with the passage of time. It is not that progressive as it happens in the pattern loss area, like in the frontal scalp, in the mid scalp, and in the crown area. So, but donor area gets thin like 8 to 9% in the whole life. Like if you see, even if you have transplanted the hair taken from central-most area, like in strip surgery, linear strip surgery, even then the 8% of them will shed off with the passage of time, like in late ages. So when we are saying that 90% of the hair will remain in the recipient area for whole life, it means 10% of them will thin out or shed off with the passage of time, with after 10, 15, 20 years. Like if we transplanted 4,000 hair grafts at the age of 40, reaching 70, 10% of them, like 400, can shed off. So 3,600 will remain there. So it is a negligible amount of hair, but it should also be explained to the patient and while doing consultation. So keep in mind, and this happens in the parietal and temporal area as well. Most of the patients, they lose temporal area in the early ages as well. But what we think is, if the patient reaches to age 40s or beyond 40s, most of the hair on back of the head and temple and parietal area, they are considered to be permanent for rest of life. We expect if they are left untreated, 10 to 15% more losses in that area. So, but once we do hair transplant surgery in FUT, follicular unit transplant, or linear strip surgery, XEN, or even FUE done in the central area, even then we expect 10% of the hair losses from the area, like in late ages. So keep in mind, most of the hair are permanent, but even then we call it aging losses. 10% of them will face aging losses with the increasing age. Thank you so very much.